it is very interesting that the pain word was already there, but it was not introduced in a scientific manner. Like, the Hippocrates, who is considered as the father of modern medicine, he first mentioned about that the pain which happens in our body, that is due to the imbalance in various types of body fluids which are there in our body. But then afterwards, the picture which here has been shown, this picture is actually taken from René Descartes' book, which was published in the year 1664. He mentioned that pain is as a result of the disturbance which is happening in the neurofibers that reaches the brain. So for the first time, a scientific attribute was given to the subject, which is the pain psychology or the pain biology. Now, as we see that it is a part of physiology or a neurocognitive aspect, it is not the pain which we use in a common man's language. From scientific world, it is the nociception. The pain feeling or the feeling of pain is actually known as nociception, which is defined as a process of communication between a site of damage of the tissue and the brain or the spinal cord, that is central nervous system. Now, as the pain goes on, the pain has got a definite pathway. Remember, I am not going into the hardcore pathways of the neurobiology, but we have to mention one thing, that pain pathway which is actually there in our body, that is made up of various substeps, which includes, number one, transduction. What is the transduction? When we have an obnoxious stimuli, we have a noxious stimuli which is happening to be a pain stimulus, that will be conducted, transduced from the mechanical to the electrical sensation, and that will be now transmitted. The second step being transmission. But ultimately, all these things have no value unless it is being perceived at the central machinery, our CPU, the brain, the perception. Now, whenever we perceive the pain, then also our work is not done. If we go on and on with the pain stimuli being affecting us, it's very detrimental for us also, because pain has been there. It is an evolutionary aspect. Pain is there in order to act as a protective device for us to survive in the midst of vagaries of nature. So ultimately, it is the modulation of the pain which is important. Through the different pathways of the pain, modulation is very important, and most of the medications also help to modulate this pain so that ultimately our nociceptive pathway or a nociception pathway is successful. Now, when I say nociception, definitely there should be some receptors which are called pain receptors which are triggered due to pain. And those are nothing but the sensory receptors, sensory nerve free endings which are there that are excited or sensitized. And when this happens, we have a very simply, I have given this picture. We have what is known as nociceptive pain. The pain associated with the tissue injury or the damage which is happening at the level of any target tissue, or even maybe a potential damage occurring at a particular tissue. So what you can see from the picture is, when you have that nociceptive pain stimuli or stimulus, that will be targeted through the spinal cord. So please note here, the most important aspect which we must not forget in terms of pain pathway is, everything happens with respect to spinal cord. Spinal cord has a special feature called dorsal horn, and that dorsal horn is the ultimate target or the trigger or the receptor which takes into account both the afferent as well as the efferent pain pathway. And then definitely comes via the spinal column comes the stimuli which is transduced and finally transmitted to the brain, which you can see from the picture itself. But all those things which I am mentioning till now is about the afferent stimuli. That means the pathways which help us to recognize that we are in pain with the help of the different other sensory structures of the brain. But what happens after that? From the brain again, there is also another pathway, we call it efferent pathway, away from the brain. So that is where the important things happen in terms of the pain receptivity. in terms of the pain modulation, in terms of the whether the pain needs to be inhibited or we should have some other sympathomimetic stimuli effect. So when we say all these aspects of this pain, we should remember one thing, that nociceptive pain is whatever the pain which we face in day-to-day life. That is about the nociceptive pain. But when I mention the nociceptive pain, it means the pain which occurs due to the damage at a particular tissue site. That has nothing to do with the nerve damage. But when we take into account another term, which is also a part of pain psychology, this is called neuropathy. And therefore, the pain is called neuropathic pain. And what is that? The neuropathy is the damage or the dysfunction of one or more nerves that result in the tingling sensation, the numbness sensation, and associated area undergoing some muscular weakness. And the pain, therefore, can be there in the peripheral nervous system as well as at the level of central nervous system. That means brain and spinal cord. We have heard about the people who have got the diabetic neuropathy, sciatica pain, the trigeminal neuralgia. This type of pain all come under neuropathy because, as you can see in the picture, the neural axon, which has been shown to be a normal, when there is injury at the level of nerves, you can see that it is called the neuropathic pain. Now here I just want to add here, trigeminal neuralgia is a very common problem, which is a very common chronic pain problem, which is there in human beings, where the fifth cranial nerve, trigeminal nerve, is being affected, and there is a pain associated in the facial region, and that particular region, whenever you eat, whenever you use that particular region of the face, you are having that neuropathic pain. That is a very important diagnostic pain of neuropathy. So neuropathy and nociceptic pain, these are two different terminologies associated with what is known as pain neurocognition. Now, to make it very simple, somatogenic pain is a type of pain when happens with respect to any target body tissue. That means the pain can be a body pain, somatic pain. That is, it can be on the skin, superficial pain. It can be deep inside. It can be subcutaneous, or it can be deep, dense inside. We call it visceral pain. Like we can have the pain at the level of stomach, intestine, brain, heart. On the other hand, we have the neuropathic pain, which I discussed. But there is another pain which we must not ignore, and that is where the problem lies. The psychogenic pain, the mental pain, the pain for which there is no known physical cause, but it has been seen from the different type of imaging devices that there is disturbance in the processing of the information at the level of central nervous system. So the pain is there, the psychological interventions should be therefore attributed at this type of pain, which is called psychogenic pain. I will come across it later on. So remember, there are two types of pain, basically somatogenic versus psychogenic pain. Now, since this is not about the neurobiology of the pain, I just want here to clarify about the historical pathway, how the pain theories have been also modulated and help us to add to our knowledge of pain psychology. Let's come to the theory which is called specificity theory. This is an old theory given by Maximilian von Frey. He mentioned for the first time that this a specific sensation, a specific sensory feeling is independent of any other sensation. That means if you have the temperature being a stimulus, you will be feeling cold or hot. If you have a pressure-based stimuli, you will feel that pressure on your body. So individual sensory aspects are there. Similarly, pain is also such an independent feeling. So it should have a specific nature of pathway. It should have a specific neurological receptor, triggers, as well as the centers for modulation. So that was the specificity theory, where the specificity of pain being a specific type of concept was introduced for the first time. Then, with the gradual evolution of scientific theories, scientific concepts, very important was finding out the neuroanatomical aspect, the temporal aspects of the pain. This was given by Henry Head, who for the first time mentioned a model where he showed the relationship did exist between the parietal cortex, temporal cortex, frontal cortex, and therefore, as well as we call it the cerebral cortex, to Together with it comes the thalamus. Now here I just want to mention, thalamus is nothing but a switch on and off device. It is just like a on and off switch. If you make the switch on, the trigger from the peripheral nervous system, from the periphery, will come to the brain. And if you switch off the device, the thalamus, then obviously you will not be getting the sensations there. So the relationship between the cerebral cortex and the thalamus is really very important, and that was being propounded in scientifically that time by Henry Head. Then gradually the integrative concept of nervous system came, who by the Charles Sherrington, who also was the person who coined the term synapse, and we are now well versed with the term, but that time the synapse term was not known, and he also got the Nobel Prize for that in physiology for that. Now, here I mentioned the aspect of integrative physiology of nervous system. That means nervous system is not a solitary attribute. We are all system-based human beings, system-based organism. We have different systems being all interlinked together, interconnected together. So if we have a pain of nerve, obviously we know about the term which is called neuromuscular structure. So the corresponding muscle, if being damaged, the pain can be attributed to the corresponding nerve through conduction through the particular nerve. So it can be also that the nerve growth factors which are there in order to maintain the good health of the nerve, that neurotropic factors should be conducted through the blood vascular system. So we require the circulatory system too. There should be a lot of hormones which play a very important role in signifying the processing of the neurological stimuli. So in that way, endocrine system works wonder. So that means the integrative action of nervous system is really important. Then, very, very important concept in the pain psychology or pain cognitive biology. It came with the get control theory of pain. From the picture itself, you can understand if we have a lots of stimuli which are coming to the spinal cord, and there is a structure called the dorsal horn of the spinal cord. Through that spinal cord, ultimately, spinal cord, that dorsal horn will decide whether I will allow the particular pain stimuli to enter and come to the brain or not. So this was the first time the gate control concept showed that the spinal cord acts as a gate, either blocking the pain signal or letting them pass on to the brain. So that was the concept given by Melzock and Wall together, who mentioned for the first time the gate control theory of pain. Now, to talk briefly about that, since I told you that I will not be coming into the deep, dense, hardcore reality of the neurobiology of the pain, but we must learn something from this gate control theory is that. Now, we often have the concept that we are in pain and we get the pain from certain types of stimuli. But it is not that always the fact that if all the pains will be coming to the pain stimuli will be coming to the brain, and the brain will be always waiting for the stimuli to come and judge thereby. Now, it has been found that, as I mentioned about the different types of afferent fibers, there are two types of fibers which we have to know. One is the large A delta fibers, and another are small C fibers. So there are two types of fibers which are important for gaining the control over the pain modulation. So once we have that stimulating the large A delta fibers, there are a number of fibers, remember, of which we are talking only about the two distinct type of fibers, definite type of fibers, which are A delta fibers and C fibers. Now, when these large A delta fibers are being stimulated, then, the gate which I mentioned, that gate will be closed. And the transmission of the corresponding neuronal stimuli will be stopped unless we are getting a continuous on and on reaction from the beginner, that means the point from which the pain is coming, that means the origin point of the pain. Otherwise, if it is only for once, then the pain will be stopped at that point. But on the other hand, if the pain is being obtained from the smaller ones, that is the smaller C fibers, then the gate will be open and the brain is ready to get the pain perception to be on. So that was the gate control theory of pain, which was mentioned by the two scientists. And there are lots of studies which has been given based upon this. There are many other concepts which has been added to this, but this is the basis of the gate control theory. Now, this person, Melzock, actually he contributed throughout his life lots of studies on this neurobiological aspect of pain. And he was again the same person, who came up afterwards in 1968 together with another scientist, Kenneth Casey. He added some motivational component of the pain. Since my topic is about the neurocognitive aspect of pain, so it's not about the neural or the neurobiological, it's also about the cognitive part. So with that, he added a motivational component of his gait control concept. He mentioned that if I really want to describe pain, pain should be described to have three important components. And what are they? Number one is the sensory discriminative system. That the sensory or discriminative system is totally based upon the biological perspective. That has nothing to do with other cognitive aspects. But then he added two other important things, which was called the motivational aspect and the cognitive aspect. So here comes the introductory term of what is known as motivational component of pain. Added to it was the cognitive system. And what was that? Now, motivational system was, it's again, the pain is there. The pain comes through the normal transmission process, but it depends upon our interpretation, or how the way we are being affected. That is how we are motivated or demotivated by that particular pain. And that is called motivational component of the pain. And again, it depends upon our own mental aspect, how we can evaluate that in terms of pain intensity, in terms of the pain stimuli. So that is a cognitive aspect. So motivational cognitive interpretation was given a very, very important aspect in terms of the gait control theory being added. And then in due course, the same person, the same scientist proposed another term, which again made evolutionary progress in the field of this pain biology. He made in 1990, he came up with another theory of pain, which is known as Neuromatrix theory of pain. As the term shows, Neuromatrix. Matrix, we know that it is a type of pattern. It is a type of base or a platform where lots of things are happening. It actually helps in the interconnection of a number of materials being featured on a particular functional domain. And he mentioned that pain should be considered as a multi-dimensional experience produced by a particular neurosignature pattern of nerve impulses, and the perception of the painful stimuli result from his active generation of subjective experience through a group of neurons, matrix of neurons, and which is called as neuromatrix. So he told that if we have a type of sadness or in a particular sadness mediated pain, if we have a grief mediated pain, no, sadness, grief, joy, these particular terms we know in terms of English literature. But there are a minor difference in this term between the sadness and the grief, between the joy and the pleasure, joy and the happiness. So that minor differences in terms of emotional attribute is being interpreted in terms of neurosignature. Because as human beings, I consider ourselves to be a very complex organism in terms of emotion. So many emotional hybridization happens in our brain. So neuromatrix theory of pain actually came as a wonderful aspect in pain biology. So that was how the history of pain theories came up in the science of pain biology. Now, whenever we get a jolt, whenever we get a particular painful stimuli, we say that we are in pain. So that pain obviously will be obliterated through medication or through any type of other treatment. And that pain, if not staying for much longer duration, we call it acute pain. So acute pain is what we face in day-to-day life, and we just forget it when the stimuli are removed. But the chronic pain is something which the doctors are concerned about. Chronic pain is something which lasts longer than 3 months, 3 to 6 months or often longer. So it's totally a solitary experience. It's totally a complex, deeply personal experience of pain in terms of chronic pain. And since I'm going to talk about the neurocognitive aspect, this particular slide will give you an idea why I say so. If you see the picture here, you can see that the physical and the mental, two things are being shown here. Physical is what we mean in terms of neurobiological perspective. But when we consider the mental aspect, it is through the emotions, it is through the cognitive attribute, it is through our neuropsychological perspectives, we are suffering or we are not suffering. So this includes lots of support from the friends, family, support from the from your own mental status. So these are the mental or the cognitive aspects which play a very important role for giving this particular sensation of what is known as chronic pain. So chronic pain is the subject of our study nowadays rather than acute pain, because acute pain we can treat it, but chronic pain is hard to treat, and it is also the chronic pain, which gives us the concept of the negative interpretations of life, including depression. So pain, it has been seen that it can negatively affect the cognitive performance, whereas cognitively demanding tasks also may reduce pain perception. That means if our brain is hijacked by some other good or positive thought processes, we often forget pain. I'm talking about chronic pain in this case, remember. So pain can negatively affect your performance. If you're in your pain, if you feel that you are in pain, you cannot concentrate on any other performance, any other particular work. But on the other hand, if you can distract yourself, then the pain perception will also be coming diminished in that particular scenario. So cognitive impairment can impact the pain experiences or pain perceptions, and it has been proved that I have mentioned before also that trigeminal neuralgia. Trigeminal neuralgia is a particular chronic pain disease where it has been found that the patient who suffer from this, they respond to the augmented pain perception. That means if they feel that they have a pain at the level of abdomen, suddenly they also feel that they have also a headache pain or a migraine pain. They have a pain in the heart. So that means they have an overall overt augmented pain perception too. And so that was given by the Mayo Clinic doctors, Fleming. Chronic pain, the cognitive pain, and the emotion basis of pain all set together to give a pain triangle. So that's the importance of pain triangle, where the neurocognitive aspects are being focused upon. Now, a very interesting concept was given by the Linton et al. So there he mentioned about the pain psychology, which was corresponding to the somatic pain, the body pain, musculoskeletal pain. So I can guarantee that in our day-to-day life till now, how many people have been there successfully in their life without a single instance of musculoskeletal pain? Because globally it has been accepted, that the low back pain is the topmost type of chronic pain noted among the people globally. So with that, here you can see the fear avoidance model of the concept, where we have got the musculoskeletal pain, where we can see, if you see the slide here, if we get an injury, if you get a jolt at a particular point, this is, I'm talking about a particular pain stimulus or stimuli rather. So obviously you will be undergoing a pain experience. Then two things can happen in terms of cognitive perspective. One is that you can have no fear, you get the mental support of yourself, your family, your doctor support. So you should have no fear or low, or if you have a fear, a low nature, low intensity fear. So you're able to confront that particular fear, and therefore you will be recovering soon. So that is a process of self-recovery phase. On the other hand, if you have a pain experience which is aggravating day to day, so we call it catastrophizing pain. So if, for example, if you have a surgery, like at the level of knee, so you have a knee pain, obviously you should be having a knee pain at that moment after surgery. So the doctors will help you to, or the physiotherapist will tell you to perform some task so that you will be utilizing that particular body. Nowadays, doctors don't say that please sit idle or have enough of bed rest. No, they say that use your organs, use your particular structure, so have mobility. But you are afraid of movement. You are afraid of having again and another bout of injury if you face any difficulty. So with that fear of movement, you really avoid that particular set of behavior, set of doctor's prescription, set of movement. So you rather escape any type of physiotherapy. So in that, you are becoming too much of vigilant about your own pain sensation, that you have that particular pain and you're hyper vigilant of your pain stimuli. So as a result, you will not be doing any type of exercise. You will not be utilizing that particular set of organ or the structure. I'm talking about the musculoskeletal pain. So I'm talking about the skeletal-muscular system-based pain. So continuous disuse, continuous disability will lead you to depression, or rather misuse of that particular structure. That will aggravate again another cycle of pain. So this is what has been mentioned in terms of fear avoidance model. Now, the climax of everything was given by the three-tiered pain matrix. Three-tiered pain matrix for the first time showed that the motivational component, the cognitive component, or rather the neurocognitive aspect is so important in our day-to-day life. You can see here in the picture, very briefly or very lucidly, I can just tell you here that when you get a pain stimuli, as I mentioned, through the afferent pathway, you are getting everything through the nociceptors and then being targeted to the part of spinal cord, which I call it as dorsal horn. So when I say the dorsal horn, then we say that from that particular region, the nociceptive stimuli will be transmitted gradually through various type of fibers. I have mentioned about the two types of fibers. So through the different types of fibers to be interpreted through the thalamus and then coming to the frontal cortex, or rather the cerebral cortex. Now here in the first tier, if you see the nociceptive tier, the first tier, here the importance is given to the thalamus, the posterior thalamus. I have already mentioned thalamus acts as a switch. So if you have the pain stimuli and the pain is going on to the brain, the thalamus is setting it on. And so the pain characteristics, the pain localization, the intensity, all are being encoded through their path, through your pain afferent pathway to ultimately come to what is known as the prefrontal cortex and associated area. We call it perceptive attentional tier. So second tier deals with the perceptive attentional tier, where the cognitive modulation, attentional modulation, and your bodily reactions to the pain will be ultimately there, because it's ultimately your brain or the central nervous system part, which is the brain here, which interprets that you are in pain. Unless your brain says that you are in pain, nothing will happen. And so PFC here, the prefrontal cortex, the cingulate cortex, the parietal cortex all come together to have that perceptive attentional concept. And finally, the highest thought processes of the pain interpretation is about the reappraisal or emotional tier. So this is how the emotional component or the cognitive component, the psychological aspects, the psychological factors are interpreted. Now, if you like, if you know that the fire, if you have got, suppose you have got a burning sensation before from a particular chemical irritant or for a particular stimuli, you know that the particular thing is affecting you. So that will create a memory in your brain. So memory formation will be there. So next time, if you have that particular pain stimuli, you will realize it. You will definitely not be there to face the same round of the pain sensation. You will be simply be withdrawing yourself or avoiding that particular pain stimuli. So reappraisal, emotional stimuli, emotional tier of the pain matrix also help you in having the memory formation due to the particular pain stimuli. So these are the different types of descending controls coming from the spinal cord through the various types of brain. And finally, modulation happens at the level of, again, the spinal cord, which helps you to interpret how the pain will be ultimately be modulated in your entire body structure. Now, people often say that till now, I'm talking about the neurobiological aspect. People are saying about the neurobiology, neurophysiology, electrophysiology, the cognitive perspective. But all the genetic lovers, they will be also very wonderfully, if they wonder, they come across this pain matrix, they will just be surprised to see that lots of studies have been done in pain biology, and it's again a now open book chapter for you. There are so many genes which are involved in the pain perception and modulation. So here this slide will ultimately give you the idea that there are so many genes which are affected, and mostly the genes which are related to the channel proteins, because we know that electrophysiology or neurophysiology physiology is based upon the propagation of neural impulses. So mostly these are the channels which are getting affected, and mostly of that, sodium channels and the calcium channels are important. On the other hand, we should not also forget, we should not also always forget about the aspects of efferent pathway. And what is that particular aspect? So when the brain says that yes, we are in pain, the goal is either to alleviate pain, that means, or to make the pain being dissipated gradually through other downstream processes. And here comes the importance of the other receptors in the pathway. Like, here comes the importance of number of chemicals which are secreted in response to the pain stimuli. Here comes the importance of bradykinin, histamine, the serotonin, dopamine, and all other structures which are all other structures of the brain which are interpreting the pain as an important stimuli. So these chemicals will ultimately help us to realize that the pain which has been there needs to be channelized for a greater goal. That means the alleviating the pain. So with that aspect, the pain perception modulation is being done by a lots of chemicals, which also do include the names we know, endorphins and enkephalins. Endorphins, they are the mood boosters, they are the natural analgesics, they are the natural sedatives which are there in our body, that they must be secreted in order to reduce pain, because otherwise we will always be in pain 24/7. So it's not that case. So it is very important for us to understand the efferent pathways which are also there in terms of the pain psychology, which includes a lots of chemicals with the help of receptors nearby those pathways. The most important receptor which I have to mention in this case is known as opioid receptor or the mu receptor. Opioids, we all are aware of the term opioids. So opioids receptors are also there naturally in our body. They are receptors, they are present in the membranes of the afferent neurons which are there. They are actually guided by the chemicals which are secreted again in response to the pain which we have already got through the afferent pathway. So in this way, the pain modulation will go on and on. Now, one interesting discovery was made recently in 18 May, as you can see, May 2020. So here, for the first time, it was seen that, that when we get the general anesthesia, that give rise to an analgesia or a loss of pain affect in our body. So we don't get the pain, okay? Now, the scientists saw that it's not due to a number of pain centers being dampening out. No, it's actually a single switch which can really dampen the lots of pain centers which are activated in the brain due to the particular pain. So the general anesthetics, they are known to modulate the pain. I'm talking about the chronic pain as well as the pain due to a particular surgery. So that is through central pain suppression circuit in the amygdala. Please remember here, amygdala is an important structure of the limbic system, which is related to the fear sensitivity. So if amygdala is on, you are too much in fear. So here a lot of inhibitory neurons are being activated in the central amygdala due to the general anesthesia, as a result of which we have lesser and lesser of pain sensation during anesthesia. So this is a type of concept which was introduced in 2020, which showed that the CGA neurons, the central amygdala neurons, could be a potential powerful therapeutic target for diminishing the chronic pain in number of patients thereby. So this was an important discovery recently. Now, as I mentioned already about the psychogenic or mental pain, the DSM-3, there are a number of diagnostic manuals for the patients in psychology, and Diagnostic and Statistical Manual of Mental Disorder have recognized the pain from time memorial onwards. But in the DSM-3, when it was introduced, then there was a mention of the term psychogenic pain disorder, which came to be replaced by another term called somatoform pain disorder. So creating so much confusion, some ornamentation of the term, so much confusion. But then came the DSM-4 criteria, where it was much more simplified. It was only told pain disorder. So it's now quite natural for us to understand pain disorder to be nothing but a chronic pain disorder or mental pain. And people who succumb to the chronic pain often go to depression, and for that, suicide cases are increasing. And every 40 seconds, the data suggests, every 40 seconds, someone in this globe is dying due to suicide. So that means the mental pain is really a very important aspect which we should be focusing on, the psychologist should be focusing on. Now, there are a number of pain assessment tools to find out the pain scale, the pain intensity. There are a number of tools and techniques being there. But here I have just mentioned for you, just to guide, that the Baker and Wong, they together used a very simplified pictorial way of assessment of the pain scale. So see, you can see that the scale is ranging from the no pain to the severe pain. So from a range of 0 to 10. So no pain, moderate pain, and the worst possible pain or severe pain. Now, it is being said that actually this, when it was first taken into consideration, it was tested on the babies. The babies showed number of facial expression. So from their facial expression, they took into account. But gradually, this concept is extrapolated to the patients who are older than 3 years, and even to the older patients also. So yeah, the pain assessment tools are, there are different pain assessment tools. There are also specific pain assessment tools for the older people also, which gives you the idea of the pain assessment. Now, I will come now to the final part, that means, which is a very important part and also a favorite part for all. That means how to manage pain. If we are in pain, how to manage. The first thing which we should not forget is medicine. Because nowadays, if I tell you that please forget about the pain only without medicine, you will not believe me. You will not believe a doctor. You go to a doctor for taking or for getting a medicine. If the doctor do not prescribe you a medicine, then obviously you will be frustrated also. So pharmacological approach is very important, and WHO pain ladder shows how you will be utilizing your medications. Okay, there is a strict guideline for usage of the medication therapy in terms of pain. If you see the ladder, there are 3 rungs, 3 steps, okay? In the mild pain, you are given a non-opioid therapy. Non-opioid means the usual analgesics which we take, the usual non-steroidal anti-inflammatory drugs which we take, like the paracetamol, the ibuprofen, etc. So these are the non-opioid analgesics which we take. And then an adjuvant therapy means, for that, if you use some other vitamin C, vitamin E, antidepressant, these are called the additional therapy. So basically, if you have a mild pain, the doctors will give you non-opioid therapy. Then, if you are having mild to moderate pain, then sometimes the weak type of opioids, like codeine, which is available, that is also given together with other therapy also. But if you have too much of pain, then the doctors are forced to give you the severe opioid therapy, and we are aware of the term morphine. So morphine is the strongest opioids which are recommended only when you do have a severe pain. So these are the pharmacological approach, and the opioids, this morphine, etc., they come to the same receptor which is called the opioid receptor. The mu receptor, it is called the mu receptor. There are a number of receptors also which respond to the opioids, various types of opioids. The mu receptor is the most prevalent receptor which is getting perturbed due to the number of attributes of pain. And this is also the same receptor which gets the medication on. And this receptor, through this receptor, the pain alleviation happens in terms of medicine. And therefore, this mu receptor is therefore the target of lots of pharmacological drugs here. And added to it, you can get the antidepressants also acting as wonder for you to have the additional effect or adjuvant therapy, because antidepressants mostly they help you to go to sleep, to have the lesser anxiety, and therefore the most of the antidepressants are often being used not to alleviate pain directly, but to give an additional support system to help you to become stress-free. But the doctors definitely do not prescribe in the very first phase all those strong antidepressants or the strong opioid therapy. Now, what I love most to consider is the other systems which are there. Now, there is a implantable pain technology, which again is found to be given by the doctors in the extreme cases. I'm talking about the severe pain. 2 things are there. One, when, as you know, that most of the drugs, when they're injected through your circulatory system, they have to reach ultimately to the brain, and they have to pass through the blood brain barrier. Most of the drugs fail to enter that barrier, blood brain barrier, so they cannot enter. And even if they are given some type of coatings so that they can actually or any other form which gets converted from one form to another metabolic form, so that they are available well inside the brain, then those particular formulations can even be given in some greater high amount, heavy dose. But the direct infusion technology, which is here, you can see in the slide itself, it is called a pain pump. It allows very small or a small amount of the medication, opioid medications, which are administered directly, bypassing the blood-brain barrier through the ultimately to the brain. That is through the central nervous system. When it is given directly to the central nervous system, you are getting the drug directly injected inside the central nervous system. So that is the essential criteria of pain pump. But please remember, this happens in the extreme of the cases. The doctors will never give you the direct infusion in case of the minute pain. And another is spinal cord stimulation technology, which gives you the very low intensity electrical signals via the spinal cord to block the pain signal from reaching the brain. So it is the spinal cord stimulation technique which are based upon the technology which is called implantable pain technology. Now, very few people know about this particular point, that if you have all throughout our body, we have certain points which are called the trigger points. Now, when I say trigger points, you have the doctors have to identify, the doctor or the physiotherapist, they have to identify a particular points which are nearby the points where you get the damage or get the pain. Now, if you say I have a pain in the shoulder point, or if you have said that I have a pain at the level of knee, there is a particular point, a trigger point, where the pain sensation is, or the pain can transcend from the particular source point to other body parts. We call it referred pain. So be it a trigger point pain or the referred pain, the trigger point injections are very important. Trigger point injection means it gives a type of local anesthetic at a particular trigger point where you are having a pain, followed by the physical therapy. So physiotherapy we call. So physiotherapy, what it is being done, now if you numb that particular region through that anesthetic, so obviously those particular pain sensation will be somehow temporarily will withdrawn. So then you just stretch on with the help of the physiotherapist. You simply stretch that particular region or massage that particular thing, and that will ultimately help you to release the knots of the muscle, which is being told as the trigger points. So the knots of muscles which are not undergoing proper relaxation, and the muscles get somehow relaxed in those particular regions, then obviously your pain will be somewhat subdued. Remember, it's not a matter of day. The technique is to be repeated and repeated as the person concerned gets the immediate benevolence activity from it. So TPI is also another form of pain treatment which is being done. And physiotherapy and the pain management, we all are aware with the term, because again, I know that you have seen in your home that many people are getting the physiotherapy nowadays. So physiotherapy, when we say, it means ultimately it will have restore your mobility, restore your function, and it can be directly through exercise. It means if you are given some knee stretching exercise, for example, you are giving some low impact aerobic exercise. On the other hand, for the people who cannot do exercise on their own, for that there can be number of stimuli like electrical stimulation, like the ultrasound therapy, the electrical nerve stimulation being done, as you can see in the picture, the transcutaneous electrical nerve stimulation, showing the very brief episodes of very low intensity electrical stimuli are being conducted. And added to it, obviously you are aware quite that nowadays we call, whenever you get a jolt here, we say that yes, please use ice pack. Okay, so this type of therapies are coming under the physical pain management therapy. Now, the thing which I love to mention every time is the alternative forms of healing. Obviously, we'll have medical aspect. Obviously, we'll have pharmacological settings, but it is ultimately the mind-body medicine which is important, the alternative forms of healing which is important, because the mind-body medicine is the concept which means that your mind is the ultimate ruler of your entire body. And the cells are nothing but the subjects of your mind. So if the mind guides the cells, or the mind gives a guidelines, rules and regulation to the cells, ultimately cells have the power to heal. So mind has the power to heal itself, and if the mind says, or the mind gives the guidelines to the cells to heal themselves, the cells also will be healed. So that's the importance of mind body medicine. And here the people or the patients are asked to, simply by using a number of therapeutic approaches, they are asked to alter the chemistry of mind. So reprogramming into some other type of positive affirmations in your mind. So that is true psyche healing, or the pranic healing, or the psycho spiritual intervention. And it's not my speech. The WHO has also mentioned about the importance of the psycho spiritual intervention in upliftment of mood, as well as treating the lots of chronic pain patients. And the two things which are very important in this aspect is, number one, the mindful awareness, mindfulness, because everything has got centered around the activities which are going on in the mind. Mind means again our brain in terms of neurobiology. So mindful awareness, if you're aware of what is happening inside our deep dense regions of our body, it is the mind who can take the control. And it's said that because we know we are system based organisms, so cells will be ultimately be getting together to form tissue getting together to form the body system together with the human body. So there is interconnection. So if there are interconnection, definitely there is signaling aspect happening. So we call it cell to cell signaling. So signaling is happening between the two cells. So if a set of cells in a particular organ gets damaged, the other already good cells should come into the rescue through the positive affirmation of the mind. And it has been seen that there has been obliteration of the bad cells and more and more dominance of the good cells. And that is the importance of mind-body medicine. It's not a very easy concept to understand in one day. It has to be realized. And the most important thing is you have to motivate yourself through your own trust or through your belief. And there is when comes the importance of what is known as energy healing and energy medicine. The healing through energy chakras, or the wheels of light, or energy centers. And what is that? If you think it totally on scientific basis, you just have an understanding. If I am talking about a cell has got mitochondria. And within the mitochondria, the ATP is being generated. So if you consider mitochondria to be beaming with energy, if you consider an organ beaming with mitochondria, if you consider an organ having all the functionality of metabolism with respect to ATP, so it is the catabolism and anabolism, which again is based upon the ATP turbulence. So in that way, energy means ATP. So energy medicine is nothing but the utilization of the participants of your energy balances in our body. When we want to heal that balance, if it is in imbalance, we call it energy healing. So let's very briefly talk about that. The acupuncture for the pain management, you must have heard about it. The acupuncture is not totally a scientific aspect I'm talking about. It is not considered by the doctors who prescribe you with the pharmacological agents. No, it's a type of alternative form of healing which I am now considering. Acupuncture, if you see the picture here, I have mentioned about the meridians. You have known about the geographic meridians, okay? See, our body is being divided into lots of meridians with respect to organs or the other structures. Like you have lung meridian, you have heart meridian, you have a heart covering, we call it pericardium meridian, you have colon meridian, etc. So acupuncture is a needle therapy. It is based upon the concept, or the belief rather, that if you have the two poles of energy for every set of organ, for every set of part of the body, then the two poles of energy, because has been known as yin and yang, the terms came from the Chinese traditional medication, because acupuncture is considered as a traditional Chinese medication based therapy. So here it is being told that when you have a pain, it means nothing but a disconnection between the two poles. So it is necessary for the acupuncture specialist to reconnect or rebalance the poles of energy, if with the help of the correct placement of the needles. Now this concept is now extrapolated in the trigger point injection also, So trigger point injection, which is now considered as a scientific methodology, that can be together being utilized in case of acupressure or acupuncture related therapy. So this acupuncture concept helps you to understand that if you have an imbalance, then through acupuncture or acupuncture therapy, you will be healed. But again, there are a number of sittings you have to do for this acupuncture, and we ordinary people cannot understand this acupuncture well, because you have to understand the meridians. There is a science, or rather there is a particular theoretical aspect for acupuncture also. If you understand that particular theoretical scientific aspect, then acupuncture can also be considered as a science, if not fully like the medical biology. Then, very briefly, mudra healing. This is also very interesting that I have told you, psychological healing or psyche healing, which totally comes from the concept of pranic healing. Pranic healing, when we say prana or vitality. In Chinese concept, it is called qi. Qi means the vitality, the powerhouse. So our body is made up of 5 elements. In Bengali, we say pancho tattva. Now, the 5 fingers represent the 5 elements. Since we are all biological organisms, in terms of biology, I must say that the 5 fingers are there. They represent the 5 elements, named as, for example, thumb, Agni Tattva, index, Vayu Tattva, middle finger, Akash Tattva, ring finger, Prithvi Tattva, and the little finger, Jal Tattva. So you can see the 5 elements are represented. This is where the importance lies. I'm not propagating the concept of the mudras and the tattvas here. No. What I want to mention is the thumb is associated with the number of other organs and the cognitive behavior. Like it is associated, thumb, for example, is associated with the stomach or the worrying nature, emotion, which is worrying nature. Index finger associated with lungs, large intestine, and sadness, depression. Middle finger with heart, circulatory system, lung, respiratory system. So emotion when you are totally have impatience in nature. Ring finger with anger, with gallbladder problem, liver, etc. And the little finger finally associated with the excretory system, kidneys, as well as fear stimuli. So what we get here, if we have a stomach ailment in terms of biology, if we have a lung ailment, if we have large intestinal pain, so if we have a pain associated with that structure, if we can modulate the thumb, index finger, middle finger, ring finger, and the little finger based mudra healing, then we can cure ourselves. So that is the concept of mudra or yoga mudra healing. Like I have only given you one brief instance of this, showing you the Vayu Mudra, where you can see the Vayu means air. So Vayu Mudra, index finger based tattva. So here it is believed and it has been shown, correlation and correlation studies have shown that it has the power to relieve more than about 150 ailments in our body, all due to the, we say, Vayu dosha, or rather imbalance of air. So if you have a knee pain, if you have a joint pain, you have a synovial pain of a fluid related pain, that means the air spaces wherever, whenever there are in our entire body system, there, even if you're indigestive problems, like you have gas like problems, so those are also very important in terms of Vayu Mudra. So lots of studies are being there for yoga mudra healing or the mudra. So I don't have enough time to explain much more, so this is very briefly mudra healing. And behavioral therapy should also be there, because just like any medications or any psyche healing, your mind has to be tuned. So for that, cognitive behavioral therapy is boosting out or promoting the positive affirmations in your life that is related to the pain. So if you have a chronic pain can be treated with the help of cognitive behavioral therapy. Another relaxation therapy is being done by the technique which is called Jacobson technique, introduced by Edmund Jacobson. He mentioned that if you relax your muscles, obviously automatically the sympathetic stimulation will be stopped. Excess sympathetic arousal mechanism will be stopped. And as a result, the pain stimuli conducted due to the sympathetic nervous system will also be wiped away. So that is the technique of relaxation. And added to it comes the autogenic therapy, which says that auto means self. So, and genic means genesis. So if you can generate your self-raising activity, self-concentration, focusing activity, help that is the relaxation therapy on your own with the help of music therapy, chanting therapy, then it is called autogenic therapy. So with that, I add here the music therapy concept. Music therapy, just remember, music is nothing but a sound. So sound in some tonal quality. So music is made up of number of frequency, and frequencies again, just like the pain, the therapy. So the music therapy reaches ultimately the brain, because it is the brain functioning which is being altered due to music therapy, and lots of pain have been obliterated by the music therapy, and it has been proved. So it is not a non-scientific method. It is never a non-scientific method, because the Buddhist mantra, the Buddhism mantra, the Om chanting mantra, these two mantras have been seen to act as a positive boost on the healing effect of many types of ailments. Continuous chanting, continuous reiterating the same words, same hymns, they have found to have an important effect on it. Why it is so? Because we know when we have a sound, then it reaches the ear through the mechanosensory hair cell, it reaches ultimately through the auditory nerves, the brain cell. And through the skin sensations, now see the spinal cord to the brain cell. So if pain is coming through those mechanoreceptors all throughout the spinal cord, reaching the brain cell, so music and pain should be coming throughout the similar types of platform. And you know, when the music therapy, since it comes in the form of sound, in the form of standing wave in terms of physics, and it is interpreted in terms of brain language in the form of brain wave category, we call it delta, theta, alpha, beta, gamma. So the standing waves, they help to ultimately have a healing effect on the respective organs which are found to be imbalanced in terms of its own frequency. Here, I would just like to add one thing, that whenever individual organs are being mentioned, every material, every structure has its own frequency. So if that frequency, if that particular vibration, if the natural synchronization is lost, then we say the particular organ is in disease condition. So if from external device, if we can help that particular resynchronization or resetting that particular organ vibration back to their own natural form, then we are safe. So with this concept comes the Soma energetics concept of David Hulse, which shows the importance of the 7 chakras which are there. We call it energy chakras or energy healing points. Now, if you really see the 7 chakras here, just note from the below to the topmost region: root chakra, sacral chakra, solar chakra, heart chakra, throat chakra, eye chakra, and the crown chakra. Where the science lies? The science lies, all the chakras have got some connection with through the respective nerve fibers to the respective organs. If you see the region of the root chakra, where the 396 hertz are being stimulated to stimulate the particular root chakra, then all the organs associated with the root chakra will be stimulated. So if those organs which are nearby the root chakra have been imbalanced, are in diseased condition, then by having or restoring the 396 hertz, which is the natural frequency of the root chakra, you can resynthesize its own type of beneficial vibrational status and just cleanse the particular elements in your body. So that's the essential aspect of Soma energetics. And here I always mention that please browse through your YouTube channels, YouTube videos, where you will get lots of healing music to each pain. Like you can see the 174 hertz pain relief music, the frequency music which is based upon that. Lots of videos are being seen here which will help you to relax, to retrieve your lost momentum of your body. So before that, I would also like to mention about, in this case, a very interesting aspect which has been proved scientifically. We call it Vibro acoustic sound therapy, harmonic sound therapy. This is again based upon the belief that every material in this universe has got its natural vibration capacity. Its harmonicity is there. So the therapy is to restore the natural vibration. through the crystal singing bowls, Tibetan meditation bowls. You can see here the picture. The 7 chakras, if they are perturbed, they can be healed with the help of the singing bowls. The set of 7 pieces are there to heal respectively the 7 chakras. The ultimate thing is to increase your natural energy flow, which opens and recalibrates your body's magnetic force. That is your aura inside your body. That is the mind-body medication. So this supports the release of the natural frequency at each and every cellular architecture, cellular moieties, so that your cell-based sound stimulation is being achieved. So feel the healing vibes. This is the concept of the day. And with that healing frequency, I always mention that there is also another term called binaural frequency. If you browse through your YouTube videos, you will see that now as the sound is perceived through different, we have 2 ears. So sound is as it is perceived at the level of brain. Brain interprets as a single tone. But there is some amount of difference in the frequency being utilized at the 2 parts of the pinna of the 2 ears. So if you have 220 hertz coming from one side, 200 coming from another side, it is the difference which is interpreted in terms of binaural. And the sound scientist, I would say sound scientist or sound therapist deals with that. This binaural, the bits to ease various types of pains depending upon the energy healing points or the chakra points. And lastly, the chromotherapy. When I say it's a color therapy, this is again based upon the chakra, because the eye chakra or the crown chakra or the throat chakra, as the cases may be, if you have suppose a throat problem, if you have a problem with cough and cold, throat problem, if you have a problem of the thyroid which is there in the throat, if you have a problem of cardiac elements, heart chakra, if you have a problem with the reproductive elements, if you have a problem with excretory system elements, you have the root chakra and the sacral chakra, especially the sacral chakra. So they have a healthy body or a healthy status of the body depends upon the natural free flow of energy. So there are multiple energy centers, please remember, of which I have told about the 7 which are considered as the major chakras, major energy centers. So if any imbalance, if any part of this energy chakras gets stuck, then the particular organs, the particular nerve which is there will be in pain. And so in order to alleviate the pain, you need to reset the chakra. So using the different colors which are there, which will actually activate that particular chakra, like the colors being mentioned here, the blue, purple, red, orange, yellow, etc. So you can see that by the help of the color, you will be healed. So that's the spread of healing vibes I can say from my aspect. So to come to the end, I would like to recollect myself, as well as to you also, the famous quote of Charlie Chaplin: to truly love, you must be able to take your pain and just play with it. So that was the concept of Charlie Chaplin. And I would therefore say in his continuation, we have to build our mental setup to stay healthy physiologically, neurologically, cognitively, psychologically. And since today is Happy Independence Day, let's be free from the pains, anxiety, mental pain, chronic pain, and we must help others also who are in pain. So let's be free, having the freedom of pain in this Independence Day. And with that, I would like to say that the pains, when we say, is a positive attitude in negative situation. So if we are in pain, it's good that we should be in pain. So I have consulted many books, and please, you should be consulting all these books for relevance of your pain related studies. There are lots of books on pain, emotion, cognition, brain body cognition, energy medicine, and mindfulness, psyche healing. All are related to pain psychology, pain biology. And with that, I would again like to thank my person, the organizers, the host institute, who have allowed me to say these things to you. And also thank you for your patient hearing. Hopefully you are not in pain. Hopefully after this talk, I will be able to significantly decrease some of your, at least mental pain. Thank you again.
First of all, Priyanka, thank you for that wonderful talk of yours.
Thank you.
Before going into the final thank you part, I just like to comment two to three things. You did an extensive area where you started with neurophysiology,
Yes.
and then you went into the genetics, and then I think so from there the total physiology, how the neurological part and the physiological part is connected, and the last part is a bit of a metaphysical part where you talked about the positivity.
Yeah.
Since I myself am a Reiki third degree holder, so I know this sense of positivity. So the last slides where you are talking, I could relate a lot of it.
Oh,
So it was
thank you.
wonderful. The domain which you spoke was vast. See, you
Yes.
just transcended from one domain to another so smoothly, but the domain over which you spoke was really vast. So thank you. But I'll ask my colleague to give a thank you vote officially. Dr. Trijit Nanda will give that. But Trijit, prior to that, there are some chat questions. Let Kea take up the chat questions and then you give up the vote.
Sure.
Thank you. Okay. Kea, are you there?
Yeah. Yes, ma'am. Am I audible?
Yes, you are very
Yes.
much audible. So take up the chat
Hello.
question.
Okay. Yes. So I will